The pain starts exactly 3 weeks after the procedure. At first, it's just cramping, uncomfortable but manageable. Maria Kuczynska tells herself it's normal. The doctors said there might be some side effects, but then the bleeding starts. Not menstrual bleeding. Within hours, the cramping becomes unbearable. She doubles over in her bunk at Ravensbrück concentration camp, clutching her abdomen. The other women gather around her, helpless. And then she sees blood, more blood than should be possible, soaking through everything. Her legs, the mattress, pooling on the concrete floor. "Help me," she whispers, but the guards don't care. The flesh between her legs is rotting. She can smell it, a sickly sweet odor of necrosis that makes the other prisoners gag. The infection is spreading through her pelvis, her bloodstream. Her fever spikes to 105 degrees. She's shaking violently now, teeth chattering, skin grey. And here's what makes this even more horrifying. 3 weeks ago, she believed she was getting a routine medical examination. They told her it was a sterility test. Simple, quick, nothing to worry about. But they lied. Today's episode is going to be extremely difficult to get through. We're covering one of the most horrific medical experiments of World War II. Something so barbaric that even the other Nazi doctors were disturbed by it. And if you think you know how bad the Holocaust was, this story will show you depths of cruelty you might not have imagined possible. Part 1. Arrival at Hell. The trains arrive at Ravensbrück concentration camp throughout 1941 and 1942, packed with women from across Nazi-occupied Europe. But there's a particular group that interests us today. Young Polish women, many of them in their late teens and early 20s, are arrested for resistance activities against the German occupation. Let me introduce you to some of them. Władysława Karolewska is 24 years old when she's arrested in Warsaw. She'd been part of the Polish underground, helping smuggle messages and supplies. Beautiful, educated, with her whole life ahead of her. She arrives at Ravensbrück in September 1941. Krystyna Dabska is just 16, a high school student who made the mistake of distributing anti-Nazi leaflets. She's pulled from her home while her mother screams and begs the Gestapo to take her instead. They don't. Maria Kuzmierczuk is 19, a nursing student. Jadwiga Dzido is 27, a teacher. Stanisława Starostka is 22. Barbara Pietrzyk is 18. These are just a few names. There are dozens more. And when they arrive at Ravensbrück, they have no idea they're about to become part of what may be the cruelest medical experiments in human history. Part 2. The camp. Now, Ravensbrück is a women's concentration camp, located about 50 miles north of Berlin. It's designed to hold around 15,000 prisoners, but by 1942, there are over 40,000 women crammed into its barracks. The conditions are exactly what you'd imagine: starvation rations, brutal forced labor, random executions, disease everywhere. But here's what makes Ravensbrück different. It has a state-of-the-art medical facility, or at least what the Nazis call a medical facility. The camp hospital, or Revier as it's called, is run by SS doctors who see these prisoners not as patients but as experimental material. And in 1942, several of these doctors have a problem they need to solve. You see, German soldiers on the Eastern Front are dying, not just from bullets and bombs, but from infections. Gas gangrene, sepsis, tetanus. These battlefield infections are killing almost as many men as combat itself. The Wehrmacht High Command is desperate for better treatments, better surgical techniques, better antibiotics. And that's where our Polish women come in. Dr. Karl Gebhardt is the chief surgeon at Ravensbrück. He's also Heinrich Himmler's personal physician and a close friend of the Reichsführer SS. In May 1942, Gebhardt faces a professional crisis. Reinhard Heydrich, one of the highest-ranking Nazis, architect of the Holocaust, has been assassinated by Czech resistance fighters. He's been shot and thrown a grenade, and he dies a week later from septicemia. Blood poisoning. Now, here's the thing. British doctors have been using a new wonder drug called penicillin, and there are rumours it could have saved Heydrich. But German doctors, including Gebhardt, didn't use it. They used sulfanilamide drugs instead. Sulfur drugs, which are supposed to prevent bacterial infections. They didn't work. Heydrich died, and suddenly Gebhardt's reputation is on the line. Himmler is furious. He demands answers. Are sulfur drugs effective or not? Should Germany be investing in penicillin research? And Gebhardt, desperate to prove that his treatment methods were sound, proposes a solution: experiments on human subjects to definitively prove that sulfur drugs work. At this point, you might be thinking, surely they'd just do laboratory experiments, right? Test the drugs on animals, on tissue cultures, on volunteers? Number. Gebhardt has something else in mind, something far more sinister. He's going to recreate battlefield wounds on healthy young women, and then deliberately infect those wounds with the same bacteria that killed Heydrich. It's July 1942 when the selections begin. The Polish women are lined up in the camp yard. Dr. Gebhardt walks down the line with several other SS doctors, Dr. Fritz Fischer, Dr. Hertha Oberhäuser. They're looking for something specific. Young women, healthy, strong, between the ages of 16 and 30. Władysława Karolewska is selected. So is Kristina Dabska, the 16-year-old, and Maria, and Jadwiga, and dozens of others. The women are told they're going to the Revier for a routine medical examination. Some of them are told it's a sterilization procedure. Standard practice for political prisoners, nothing to worry about. Others are told nothing at all. Little did they know, they were about to become what the other prisoners would call cruelty, rabbits, as in experimental rabbits. Let me walk you through what happens to these women in explicit medical detail, because you need to understand exactly how monstrous this is. On July 22nd, 1942, a group of 6 women are taken to the operating room. Władysława is among them. They're told again that this is a sterilization procedure. They're given anesthesia, sometimes full general anesthesia, sometimes just a local block, and laid on operating tables. And then the surgeons get to work. They don't sterilize the women. Instead, they make deep incisions into their legs. These aren't small cuts. They're major surgical wounds, sometimes up to 6 inches long, cutting through skin, muscle, all the way down to the bone. In some cases, they remove entire sections of bone. In others, they sever muscles and nerves. And then, and this is where it gets truly evil, they deliberately contaminate the wounds. They pack the incisions with wood shavings, dirt, glass fragments, and rusty nails. They inject the wounds with cultures of Streptococcus, Staphylococcus, Clostridium perfringens, the same bacteria that cause gas gangrene and sepsis on the battlefield. Then they sew the women up. The goal, ostensibly, is to see if sulfur drugs can prevent or treat these infections. But here's the thing. Gebhardt doesn't actually want the drugs to fail. He needs them to work, to prove his treatment of Heydrich was correct. So the entire experiment is designed with a built-in bias. But reality doesn't care about Gebhardt's ego. The women wake up from anesthesia in agony. The pain is immediate and overwhelming. But they're told this is normal post-surgical pain. They're given minimal painkillers, often nothing at all, and sent back to their barracks to recover. Except they don't recover. Within 24 hours, the fever starts. The wound sites become hot, swollen, and excruciatingly painful. The infections are taking hold exactly as designed. Now you can imagine what it's like in those barracks. These young women lying on thin mattresses, burning with fever, their legs swelling to twice their normal size. The smell of infection fills the air, that distinctive sickly sweet smell of necrotic tissue. Some of them are brought back to the revier and given sulfur drugs. Others are left untreated as control subjects. The doctors take meticulous notes on who lives and who dies, who develops gangrene, who goes into septic shock. Maria Kuczynska, the woman from our opening, is one of the unlucky ones. Her wound becomes severely infected. The tissue between her hip and knee is dying, turning black and green with necrosis. She develops gas gangrene. Those bacteria are literally producing gas inside her leg tissue, making it crackle when you press on it. She's in and out of consciousness. The fever has her hallucinating. And the doctors? They're excited. This is exactly the kind of severe infection they wanted to study. They bring her back for a second surgery, not to save her, to observe. They cut her leg open again, take tissue samples, document the spread of the infection. Then they sew her back up and wait to see if the sulfur drugs will work. By some miracle, she survives. But her leg is permanently damaged. She'll walk with a severe limp for the rest of her life. But here's where it gets even worse. Because the experiments don't stop with that first group. Between July 1942 and August 1943, Gebhardt and his team conduct 6 separate rounds of experiments. Each round is more brutal than the last, involving around 74 women in total, though the exact number is disputed and may be higher. In the second round, they increase the severity of the wounds, deeper cuts, more tissue destruction. Some women have entire sections of fibula or tibia removed, bones literally carved out of their legs while they're unconscious. In the third round, they cut off blood supply to the limbs before infecting them, trying to simulate the conditions of battlefield tourniquets. In the fourth round, and I want you to understand how depraved this is, they begin shooting the women. Yes, they literally shoot prisoners in the legs with pistols, then infect the gunshot wounds to study battlefield injury treatment. Jadwiga Dzido, the 27-year-old teacher, is shot in the leg and then has her wound packed with glass fragments and bacteria. She develops massive infections, undergoes multiple surgeries, and is left permanently disabled. And through all of this, the women know what's happening. They're not stupid. After the first operations, word spreads through the camp. The other Polish prisoners figure out what's going on. These women aren't being sterilized. They're being used as lab rats. Now at this point you might be wondering, why didn't these women refuse? Why didn't they fight back? They did. When the SS comes for the next round of selections, some of the Polish women refuse to go. They hide in the barracks. They stage sit-down protests. They know that if they go to the revier, they might not come back. Or if they do, they'll be crippled for life. The SS response is brutal and predictable. The women who refuse are dragged out of their bunks. They're beaten. Some are thrown into solitary confinement, the bunker, where they're tortured with cold water, starvation, and sleep deprivation. Stanisława Starostka is one of the refusers. She's 22 years old, and she's terrified. She's seen what happened to the women from the first operations. She's watched them come back with their legs grotesquely swollen, screaming in pain. When the guards come for her, she clings to her bunk. She fights. It takes 4 guards to drag her to the operating room, and she's screaming the entire way. Other prisoners can hear her through the camp, a sound that will haunt them for decades. They operate on her anyway, both legs this time, deep incisions packed with infected material. When she wakes up, she wishes she were dead. But here's what the Nazis don't anticipate. The other Polish prisoners become witnesses. They start documenting everything. They smuggle out messages to the Polish underground describing the experiments in detail. Names of doctors, dates of operations, names of victims. Some of the women who underwent the operations, the ones who survived, make secret drawings of their scars, hiding them in the barracks. They're collecting evidence, even though they have no idea if they'll ever live to testify. By late 1942, Gebhardt has his results, and from a purely scientific standpoint, if you can call this evil science, the data is mixed. Some sulfur drugs show moderate effectiveness against certain infections. Others don't work at all. The mortality rate among the test subjects is around 6%. 5 women die directly from the infections or complications. Dozens more are permanently disabled. But Gebhardt doesn't care about the human cost. He writes up his findings in glowing terms, presents them at medical conferences, publishes them in German medical journals. He's proven, he claims, that sulfur drugs are effective battlefield treatments. He's exonerated himself for Heydrich's death. His reputation is restored. In May 1943, he presents his research at a major conference in Berlin, attended by hundreds of Nazi doctors and military officials. He shows photographs of the infected wounds, charts documenting bacterial counts, survival statistics. He makes no mention that these results came from experiments on unconsenting prisoners. To the audience, it just looks like cutting-edge military medicine. Several doctors in the audience are reportedly disturbed by the implications, but none of them speak up. This is Nazi Germany in 1943. Questioning SS medical research is a good way to end up in a camp yourself. And so, the experiments are declared a success. Gebhardt is promoted. He receives commendations from Himmler himself. The women? They're sent back to the general camp population, crippled and traumatized, to continue their sentences. Fast forward to April 1945. The Soviet Red Army is approaching Ravensbrück. The SS begins evacuating the camp, forcing prisoners on death marches westward. Many of the rabbits, the experimental survivors, are too disabled to march. The SS considers executing them all to destroy the evidence. But in the chaos of the camp's final days, the plan falls apart. Some SS guards simply abandon their posts. Others are too busy destroying documents to bother with executions. On April 30th, 1945, the Red Army liberates Ravensbrück. They find approximately 3,000 prisoners still alive in the camp, many of them near death from starvation and disease. Among the survivors are the rabbits. Władysława Karolewska is there, barely able to walk but alive. Kristina Dabska, operated on at age 16, survives. WW2 survives. Maria survives. They're taken to Soviet field hospitals, where doctors see their scars and immediately realize something horrific happened here. These aren't battlefield wounds. These aren't work injuries. These are deliberate surgical mutilations, infected on purpose. The Soviet doctors document everything: photographs, medical examinations, sworn statements. And the survivors, weak and traumatized as they are, start talking. They tell the doctors about Gebhardt, about Fischer, about Oberhäuser. They name names. They describe dates, procedures, other victims who didn't survive. They've been waiting years for this moment, the chance to testify, to make sure the world knows what was done to them. In late 1946, preparations begin for what will become known as the Doctors' Trial, one of the subsequent Nuremberg trials focusing specifically on medical war crimes. 23 Nazi doctors and administrators are indicted. Dr. Karl Gebhardt is among them, charged with conducting medical experiments without consent, crimes against humanity, and membership in a criminal organization. Dr. Fritz Fischer, who performed many of the operations, is also indicted. So is Dr. Hertha Oberhäuser, one of the few female Nazi doctors to face trial. The prosecution needs witnesses. They need survivors who can testify about what happened. And that's where the rabbits come in. Several of the Polish women volunteer to travel to Nuremberg to testify. This is incredibly brave. Many of them are still recovering from their injuries, still dealing with chronic pain and disability. But they're determined to face their torturers in court. In December 1946, Jadwiga Dzido takes the stand. She's 31 years old now, walking with a severe limp. In the courtroom, she removes her skirt and shows the tribunal her scars, massive, keloid scars running the length of her leg, clear evidence of major surgical trauma. She testifies for hours, describing in explicit detail what was done to her. The courtroom is silent. Several people are visibly weeping. The judges look horrified. Gebhardt sits in the defendant's dock, expressionless. He doesn't deny what happened. Instead, his defense is that the experiments were necessary for the war effort, that the subjects were criminals anyway, that this was legitimate military research. The tribunal doesn't buy it. Not for a second. On August 20th, 1947, the verdicts are announced. Karl Gebhardt, guilty on all counts. Sentenced to death by hanging. Fritz Fischer, guilty on all counts. Sentenced to life imprisonment, later commuted to 15 years. Hertha Oberhäuser, guilty, sentenced to 20 years imprisonment, served 10 years, released in 1952, a travesty of justice that enrages the survivors. On June 2nd, 1948, Karl Gebhardt is executed at Landsberg prison. His last words are reportedly defiant, claiming he was following orders and advancing medical science. He was 49 years old. Most of his victims had been teenagers. So what happened to the survivors, the rabbits of Ravensbrück? Many of them returned to Poland after the war, but their lives were forever altered. The physical disabilities were obvious: chronic pain, limited mobility, scarred tissue that never properly healed. But the psychological trauma was equally devastating. Władysława Karolewska eventually moved to the United States, where she spent decades speaking about her experiences to schools and universities. She testified at multiple war crimes trials, always willing to share her story despite the pain it caused her. She died in 1995 at age 78, Krystyna Dabska, who was just 16 when she was experimented on, struggled with PTSD for the rest of her life. She had nightmares about the operating room until her death in the 1980s. Jadwiga Dzido immigrated to the United States as well, settling in Chicago. She became an advocate for Holocaust education and medical ethics. Whenever she was asked why she testified at Nuremberg despite the trauma of reliving the experience, she always gave the same answer. Someone had to speak for those who couldn't speak for themselves. She died in 2001 at age 86. Maria, Stanisława, Barbara, and so many others lived quiet lives after the war, trying to process what had been done to them. Many married, had children, built careers. But they all carried those scars, physical and emotional, until their deaths. Now I want to talk about why this story matters beyond just being a horrific historical event. Because the Ravensbrück experiments, along with the other Nazi medical atrocities, fundamentally changed how we think about medical research ethics. At Nuremberg, the tribunal established what became known as the Nuremberg Code, a set of 10 principles for ethical human experimentation. The first and most important principle, voluntary, informed consent, is absolutely essential. No exceptions. This seems obvious now, but before Nuremberg, there were no international standards for human research. Doctors regularly experimented on patients without their knowledge or consent, especially patients from marginalized groups, prisoners, mentally ill people, minorities. The Nuremberg Code changed that. It established that research subjects must voluntarily consent without coercion, be fully informed of risks and benefits, have the right to withdraw at any time, be protected from unnecessary suffering. These principles became the foundation for modern medical ethics. They led to the Declaration of Helsinki in 1964, the Belmont Report in 1979, and eventually to the strict research ethics boards and informed consent processes we have today. Every time you sign a consent form before a medical procedure, every time a researcher explains the risks of a clinical trial, every time an ethics board reviews a study protocol. That's the legacy of the Ravensbrück rabbits and the other victims of Nazi medical experiments. Their suffering wasn't meaningless. It exposed the absolute necessity of ethical constraints on medical research, no matter how important the potential benefits might seem. But this story also raises some deeply uncomfortable questions that we still grapple with today. First, what do we do with the data from these experiments? Gebhardt's research was evil and unethical, but some of the findings about wound infection and treatment were scientifically valid. Should modern researchers use that data, or would doing so validate the atrocities? This same question came up with the Nazi hypothermia experiments. Evil studies on freezing prisoners to death, but which produced data about human cold tolerance that doesn't exist anywhere else. Medical ethicists are still divided on whether using such data, even to save lives, constitutes a moral compromise. Second, how do we balance military necessity against medical ethics? The German military genuinely needed better battlefield medicine. Soldiers were dying from infections. In their twisted logic, the Nazis believed sacrificing a few dozen criminals to save thousands of German soldiers was a reasonable trade-off. We reject that logic today, but the underlying tension remains. During wartime, when lives are at stake, how far can military medicine ethically go? Where's the line between necessary innovation and exploitation? Third, how could ordinary doctors become monsters? Gebhardt, Fischer, and the others weren't sadistic psychopaths. They were educated physicians who took the Hippocratic Oath. They saw themselves as scientists advancing medical knowledge for the greater good. The answer, chillingly, is that they stopped seeing their victims as human beings. Once you dehumanize someone, classify them as a criminal, an enemy of the state, a subhuman, it becomes easier to rationalize doing terrible things to them. This pattern repeats throughout history. The Tuskegee Syphilis Study, Japanese Unit 731, experiments, CIA torture programs, disguised as research. Whenever doctors stop seeing their subjects as people deserving of dignity and respect, atrocities become possible. Today there are memorials to the Ravensbrück rabbits in Poland and Germany. At the site of the former Ravensbrück camp, now a memorial museum, there's a special exhibit dedicated to the medical experiments, featuring photographs of survivors and displays of their testimonies. In Warsaw, there's a monument showing a woman with scarred legs, commemorating all the Polish victims of Nazi medical experiments. But the most important memorial, really, is the one that exists in our medical ethics codes and research protocols. The regulations that protect human subjects today, the informed consent requirements, the ethics review boards, the right to withdraw from studies. These are the rabbits' legacy. Their suffering brought us the safeguards that protect millions of research participants today. And that's why stories like this, as painful as they are to hear, need to be told. We need to remember what happens when medical ethics are abandoned. We need to remember the names and faces of the victims, not just statistics, but real people with hopes and dreams who had their bodies and lives stolen from them in the name of science. Vladislawa, Christina, Jadwiga, Maria, Stanisława, Barbara, and the dozens of others whose names we may never know, who died on those operating tables or from infections in the barracks, who never got to testify at Nuremberg, who never got to see their torturers face justice. We remember them, we honor them, and we ensure that never again actually means never again. If you want to learn more about the Ravensbrück medical experiments, I highly recommend the book The Ravensbrück Lapins by Caroline Moorhead, which tells the stories of these women in much greater detail. There's also extensive documentation from the Nuremberg doctors' trial available through the Holocaust Museum archives. Before you go, please hit that like button, subscribe to the channel, and turn on notifications so you don't miss future episodes. We cover stories like this every week, true stories that are shocking, disturbing, and important to remember. See you next episode.